Hello, and thank you for joining me on the webcast today. I am Dr. Liz Plowman. I am a physical therapist, and I am the Myasthenic PT. Today, I'd like to talk to you about physical therapy for myasthenia gravis. There are many people who ask me, what do I do? I've been referred to physical therapy. I don't know what to expect. How does it even help me? So I want to address those things today. I also want to note that my presentation today is for two audiences. One, for the patients with myasthenia gravis who have questions about just what physical therapy is and how it can help with MG. But also for physical therapists who want to know how do I work with the myasthenic patient that has been referred to me, and what are my goals. There are three main times that a person with myasthenia gravis might be referred to physical therapy. The first is for safety and function. This typically occurs either earlier in the disease process or after some sort of a flare or a change in function. The focus of physical therapy at this point is to help restore function and to help promote patient safety. So interventions for this particular patient would be fall prevention, keeping them safe in their home, working on balance, working on mobility, how to get in and out of a chair, how to move around the home safely. This may also look like assistive devices, such as canes or crutches, walkers, just kind of whatever's appropriate. The physical therapist can help that patient with MG figure out which device is going to be best for them, because and I can get into this on an entirely different webcast, but depending on where the specific muscle weakness and fatigue is, what muscles tend to be a little bit more affected, different assistive devices are going to be more appropriate. So for example, someone with a lot of weakness and fatigue in their hips, particularly in the back of the hips, may not do that well on a walker. They may do better on crutches or a more supportive cane, for example. But like I said, I can get into an entire another webcast on that. We may also look at activities of daily living, the things that are causing difficulty or causing increased fatigue. So things like moving around, things like bathing, and how do I wash my hair? How do I get dressed? How do I dry off? How do I brush my teeth? How do I prepare a meal? I'm having trouble doing laundry. So those more functional things. This is also when we'll probably call in and work closely with our colleagues in occupational therapy, because this is very much in their wheelhouse as well. And then we'll also look at energy conservation. So how to save those spoons and how to have more energy for more important activities especially toward the end of the day when we get more fatigued. So this is kind of the first group of patients for physical therapy with myasthenia gravis. So this is very much safety, function, mobility. The second group is for myasthenia gravis that's a little better controlled. And this is where patients are doing pretty well. They usually have a really good medicine regimen going on, whether that's medication, IVIG, infusion, and maybe they've had thymectomy, what have you, but there's a medical intervention in place that is really improving the quality of the muscle function, improving the quality of the communication at the neuromuscular junction, making life a lot easier for the patient with MG. And so patients might be referred to physical therapy at this point, or would definitely benefit from physical therapy at this point, because now that the medical intervention is in place and that muscle is getting much better communication, thanks to the medicine, now we can actually strengthen, and we can actually prevent muscle atrophy or deconditioning, which is where that muscle actually loses tissue when it's not used enough. And we can potentially reverse that muscle atrophy as a result of the disease process. So this is a really exciting time to go to physical therapy, because we can look at actually increasing strength, which a lot of people with MG think is not possible, but it is. We can increase physical activity, both in the amount of physical activity and the quality of physical activity. If you if your goals are to play on the floor with your kids, or take a walk around the block, something like that. That's something that we can start helping you with. And then for those that desire, especially those that used to have an active lifestyle prior to myasthenia gravis, we can help them get back to exercise and to physical activity as desired. Of course, modified and taking myasthenia gravis into account. But this is an exciting time to go to physical therapy when the medicine is really kicked in at this point. And the third time that we typically see patients with myasthenia gravis in physical therapy is for other issues that are not myasthenia gravis related. It's important to note that while myasthenia gravis may dominate the majority of these patients' attention and their time and their energy, it's not the only thing going on. People with myasthenia gravis can get back pain, neck pain. They can have joint issues. They can have injuries, and those would all benefit from physical therapy as well. So that's the third category of where physical therapy comes in for myasthenia gravis, is to treat these other things. But it is very, very important for the physical therapist to be cognizant of the patient's myasthenia gravis, and how to work with it, and how to avoid over fatiguing muscles, and how to dose that intervention appropriately to treat the condition. So to sum that all up, essentially there's three main times that PT is really, really beneficial for someone with MG. One is for that safety, function, and mobility. Two is when the disease is better controlled by medicine, that we can work on actually strengthening, reversing atrophy, and improving physical activity. And then three is for all of those other issues that people with MG are not immune to: back pain, neck pain, etc. So physical therapy for those things, but taking that myasthenia gravis into account. So I hope that this helps shed some light on why physical therapy for myasthenia gravis. If you have any questions, please feel free to reach out to me. My email address is themyasthenicpt@gmail.com. You can also send me a direct message. It does go directly to me. I read them all and will respond. I would love to answer any questions that you have, whether you're a person with myasthenia gravis wondering if physical therapy is helpful for you. Maybe you're in physical therapy right now and want to be able to communicate a little bit better with your physical therapist. Or if you're just interested in talking a little bit more about how PT can be beneficial for you, please feel free to reach out to me. I'd love to talk to you. If you're a physical therapist and you are wanting a little bit more information on working with people with myasthenia gravis, please feel free to reach out to me as well. Thank you so much for joining me today. It's an honor to have you watch my webcasts. I'm super thrilled that you take the time out of your day to do that. I hope that they're helpful for you, and I look forward to seeing you next time.